Hey guys, welcome to Pharma Palette. Today we will be discussing about the oral anti-diabetic classification with simple tricks. So this classification is basically divided into three different classes in that the first one is the drugs which enhance insulin secretion, and the second class is the drugs which are useful for overcoming the insulin resistance, and the third class is miscellaneous drugs. So the first class is further divided into two classes. So first one is potassium channel blockers and the another class is DPP4 inhibitors. Here DPP4 inhibitors means it is dipeptidyl peptidase 4 inhibitors. So this potassium channel blockers are again divided into two classes. So first one is sulfonylureas and the second class is meglitinides. So this meglitinides class is also called as phenylalanine analogs. So to remember the drugs under the sulfonylureas, just remember the term glitol. So glitol is the trick here. So almost all the drugs in this class will be starting with the word gli, and there is one drug which will be starting with the letter tol. So the drugs are, so first one is glipizide. Second one is gliclazide. Third one is glimepiride. Fourth one is glibenclamide. And tol means it is tolbutamide. So simply remember glitol for the sulfonylureas. Then you can write the drugs glipizide, gliclazide, glimepiride, glibenclamide and tolbutamide. So remember gli and tol. So the second class is meglitinides, which are also called as phenylalanine analogs. To remember the drugs under this, just remember this term meglitinides. So gli and nide. These drugs will be ending with the term gli and nide, glinide. So the drugs are, one is repaglinide and the other one is nataglinide. The second class is DPP4 inhibitors, which is dipeptidyl peptidase 4 inhibitors. So to remember the drugs under this, just remember there are three names. One is Sita, Saxa and Lena, Ye Log Wild. Sita, Saxa, Lena, Ye Log Wild. Then you can write all the drugs under this. And also remember that these drugs will be ending with the term gliptin. They will be ending with the term gliptin and starting with these words. Now let's try to write the drugs. So the first one is sitagliptin. Second one is saxagliptin. Third one is linagliptin. Fourth one is elogliptin. Fifth one is vildagliptin. So that is about the first class. Now the second class is the drugs which are useful for overcoming the insulin resistance. They're divided into two simple classes. One is biguanides and the other one is thiazolidinediones. So here just remember that biguanides are AMPK activators, whereas thiazolidinediones are PPAR gamma activators. In biguanides, there is only one single drug which is metformin. Now, how do you remember that? Biguanides, metformin. And in the thiazolidinediones, remember that these drugs will be ending with this term glitazone. So these drugs are, one is pioglitazone, other one is rosiglitazone. And the third class is miscellaneous. So it is further divided into four classes. So the first one is alpha-glucosidase inhibitors. Second class is amylin analog. Third class is dopamine agonist. And the fourth class is sodium glucose cotransporter 2 inhibitors. To remember the drugs under this first class, which is alpha glucosidase inhibitors, just remember a sentence: Ekar, Migo, and Vogli. Ekar, Migo, and Vogli. which means one is acarbose. Migo means it is meglitol. Wogli means it is voglibose. And in amylin analogs, just remember amylin, pramlin, pramlin, amylin. So the drug is pramlintide. Next one is D2 agonist, which is dopamine D2 agonist. Here there is one single drug which is bromocriptine. And the last class is sodium glucose cotransporter 2 inhibitors. These drugs will be ending with the term gliflozin. So the drug here is dapagliflozin. So that is all about the complete classification of oral anti-diabetic drugs. If you found this video helpful, don't forget to like, share and subscribe to Pharma Palette.